Hello, my name is Dr. 𝐁𝐨𝐿, and I want to talk to you a little bit about Botox versus filler for wrinkles. A lot of people often want to know, when do they use Botox versus filler, where and why? Botox is a chemical that reduces the communication from your brain to the muscle group. And what that does is it helps to slow the muscle function down. So it softens the wrinkles so you don't see the ridges. And typically people like to use Botox. It's most effective in the forehead area, around the eyes, in between the eyes and the glabella, or around the eyes and the crow's feet. And also around the mouth area to kind of help when you have kind of a frown area, it kind of helps to pick up the lips so you don't look like you have a resting frown. Filler is made up of hyaluronic acid, which is a natural occurring substance that's already found in our body. It's the substance that gives our skin and our joints support. So we use filler to fill in the gaps where you have areas of deficits or deficiencies or volume loss. So fillers are good to kind of lift up the fine lines and deep lines. It's also good to give a little bit support and structure to areas where there's volume loss or fat loss. So that could be around the cheek area, around the laugh lines, the nasolabial folds, and lower around the mouth and jaw, where you see a lot of wrinkling from skin laxity. In terms of Botox, there's different brands, but they generally all last about the same and work the same, lasting about 3 months. On the other hand, fillers are different. There's a vast variety of fillers, and we choose the fillers based upon the indication and what we're trying to treat and the goals we're trying to achieve. So if we're looking to fill in thin lines, that's more in the superficial layer, we're going to use thinner fillers like Restylane Silk, Volbella, Bellatero. If we're looking to provide a little bit of volume, give your skin a little bit of support, and a little bit of structure, we're going to use thicker fillers like Voluma or Restylane Lift. If we're looking to kind of have a natural effect in areas that provide a lot of movement, but you don't want it to be too thick and you don't want it to be too thin, we're going to use fillers like Juvederm, Restylane Define, Restylane Refine, as they're a little bit more forgiving. If we're looking to fill in under the eyes, because that area is very sensitive, draws in a lot of water, very prone to bruising, also very prone to seeing the filler because it is so thin, we're going to use fillers that are very thin, that are soft and subtle, like Volbella or Bellatero or Restylane Silk. Botox and filler are so popular these days, but it's an art form, and it's very important that you pick the provider that knows how and where and what to place Botox versus filler. Here at Reflections, we're vastly trained, very well knowledgeable about what it is that we need to do. We are a talented group of physicians who have a lot of skill set and training. We're able to both artfully and carefully create a look that's best for you. If you found this video to be helpful, please give us a thumbs up. And if you'd like to learn more about this topic and other topics, please subscribe to our channel.